And here we go. Welcome everybody to The Big Idea. I'm Dr. Jeffrey Hanna with Clear Chiropractic, and I've got a bit of a story to go through here today about a whiplash case. I had somebody reach out to me and explain a bit of a situation that they have going on here, and they wanted to know a few of my thoughts here. And so I figured let's do a bit of a deep dive into this one, and this one's a bit of a doozy here. So let's go ahead and jump right into it right about there. Okay. I was in a car accident, not entirely sure what happened, between swerving and getting stopped due to being unconscious. Apparently, I hit 3 young trees, pushed my engine back 6 inches, snapped the axle, pushed the wheel right through the floor, which crushed my foot and made me lose consciousness. In other words, this is not a small or insignificant little impact. So here's what they say happened. Due to ER conditions, and they're not going into the details right here, told the doctor I might have crushed the bones in my foot, but I don't know because they were unconscious, and simply asked if I was awake during the accident, to which I responded I'm not sure. I was still dazed a day or two later and got discharged with a couple of Advil. Okay. I had pain so bad in my head, I struggled to not get sick and pass out. And I haven't been sick to my stomach in 15 years prior to this to give you a gauge of the pain. I was in tears from it and couldn't move much without pain. And for clarity's sake, I didn't notice my foot that was not only crushed between the dash and the wheel at the ankle and the arch, but when I woke, I just yanked on as hard as I could to unpin it and unkicked my door open and walked on it. In other words, the person didn't realize that they'd fractured their foot, everything. They were just so disoriented. But my head was significantly worse, which by a day or two, I didn't have much pain like that besides a couple of times. One time, I twisted my face, someone to my left, and had pain somewhere between my neck and shoulder. So bad, I literally couldn't talk at all or do anything at all when this happened. And once more, when I leaned forward to stand up. But wait, it gets better. No symptoms for 9-ish months. And then the weakness, severe neck and shoulder pain, burning, dizziness, and sudden TMJ area pain. That area was so inflamed daily, co-workers in an already hot factory setting could feel heat radiating off me from 1.5 feet away. I did factory work for a year and was forced to go on medical leave because of the loss of strength, pain, dizziness, migraines, cervicogenic headaches, etc. Started working in a warehouse after 2 years and hit my head quite hard again. Found out literally days before I had a concussion, still after 3 years. And I started blacking out for undetermined amounts of time. I've been woken up in the refrigerator at one time, standing there totally unconscious. Other times would wake up and whatever I had in my hands would be halfway to the floor, typically triggered by light and other sources of intense stimulation, which progressed into what I can only describe as temporal lobe focal aware seizures, extreme memory problems, trouble speaking, finding words, and understanding people's words, balance issues, severe migraines, etc. The accident was in 2019. I still struggle today, 2024, and I'm only 26 now. So we've got quite a little bit of a history in there, and it's not going to be up to me to say what should or should not have been done back in the day. Coulda, woulda, shoulda, that kind of thing. But what I want to do is I want to take this case here and break it down a few different thoughts in terms of what is very likely going on and what the avenue of approach needs to be. Why is that? It's because a lot of people are going to be, having car accidents and they may go to the hospital, but if they're orientated, they think that, nothing's broken or anything like that, they're oftentimes sent on their way. And sometimes these symptoms may not show up till later. A lot of times people then will have a weird cluster of symptoms. And I don't know if this person's had any different kinds of tests done with the medical docs, with the neurologist. I would strongly recommend that here first and foremost. But there's potentially a lot of things that are going on here. So let's rewind and let's dive into this just a little bit more. Okay, we're first going to start with the issue of the car accident itself. We know from the research that all it takes to cause a whiplash injury is going to be 5 to 10 miles an hour. This one here, we have no idea how fast it was, how hard it was, but if it was enough that the engine block moved back and this person says they're not sure what happened, this demands investigation. This is at the very least, a grade 3 concussion. So let me back up on that a little bit. Concussions are going to be categorized into 4 general categories of severity. Grade 1 is a sense of disorientation, stars if you would, feeling a little bit dizzy, a little bit cloudy for less than a minute. A concussion has still happened, and a concussion is no laughing matter. It is an injury to the brain. A grade 2 concussion is where you have those same kind of symptoms. You don't necessarily lose consciousness, but they are lasting for more than a minute. In other words, it's a little bit more severe. A grade 3 concussion is where a person loses consciousness. And this could be even for but a split second, but again, less than a minute. A grade 4 concussion, this is where a person loses consciousness and or memory for a minute or longer. In other words, there is a lapse in their reality. Anytime that we are dealing with one of these kinds of issues, first and foremost, a head CT scan to determine if you have skull fracture or bleeding on the brain, because it may not be showing up instantaneously, but especially if the symptoms become more pronounced, that demands further investigation. The same thing goes with an MRI. Now, 2 things that are worth pointing out here. Number 1, unless you do see bleeding on the brain, you cannot diagnose a concussion from a CT or for an MRI scan alone. This is a clinical presentation based on a person's symptoms. It's only if you're seeing overt damage. It doesn't change the fact if a person has had a traumatic brain injury. But the second part to that is that it is impossible to injure your head in this way without also injuring your neck, especially if a person notices that neck movements, what we oftentimes describe as head movements, after the fact can bring on the symptoms. This would be consistent with a whiplash. In other words, we can't rule one or the other out. And there's emerging evidence that as far as the standard of care goes, anytime a person's got to have a head injury, not only should you be assessing the function of the brain to see if it's healthy, you should also be assessing the function of the neck, because the neck will absolutely impact function of the brain. So there coulda, woulda, shoulda, maybe been a few tests done back in the very beginning. This person didn't say if they had it done or not. We're not going to get into that. Relatively speaking, no harm, no foul, at least on the bleeding side of the equation, because if there was a bleed, then 4 years on, this person would have been having far more acute kinds of issues that would have demanded immediate investigation. Now, that said, as we jump into the second piece here, where they're saying that they had these persistent kind of symptoms and they had these blackout episodes that would come afterward, well, this could suggest that there is a disruption in blood flow. Even if it is but a momentary lapse, we have a number of receptors in the neck that are responsible for monitoring blood flow to, from, and within the brain. If these centers are either damaged or if they've become sensitized over a period of time, certain relatively innocuous movements of our head, such as turning like this, looking up, leaning the head forward like that, they can spark a cascade where the brain and the body is going to go into safety shutdown mode, which is called fainting. Sometimes it'll be to the point where a person simply falls all the way down. And other times it's a momentary blackout where a person's able to catch themselves, but there is that sudden and momentary lapse where there could be a disruption in circulation to the head. Again, this can be either a head issue or this can be a neck issue. One way or another, this requires investigation. Now, the next part that I want to get into, and this is the real doozy here. No symptoms for 9 months. Okay? We know from other research as it's done to whiplash, concussion, that when a person has they're hit from behind, say for example in a car accident, so they're driving forward and they get rear-ended like this, pain usually appears within a day and usually pretty acute. But if a person has a front-on injury, which is where the head goes forward then back like this, symptoms on an average will take about 14 days to show up. And sometimes they can take even longer. And this is the importance of understanding as it relates to head and neck injuries, the significance of compounding interest. There's an old story that goes something like this. There's a young, peasant or a wise person, something like that. And I don't know what they do, but they save the local king's life in a certain region. And the king says, I would like to give you some kind of a reward. And what the person is, something to the effect of, okay, I would like a single grain of rice, and I want you to double that every single day for about 30 days. And the king thinks nothing of it at the time and says, okay, yep, absolutely. I guess it can't be that much. Now, let me make this maybe a little bit more tangible into our modern world here. Let's say that we have a calendar month, and the calendar month is going to be 30 days. We'll make it nice and simple there. And let me give you a choice. Let's say that I was to give you one of two offers. I will offer you $1 million that you can take right now, cash in the bank, or we will start out with 1 penny, and every single day I will double that 1 penny. What would you like? And the vast majority of people are probably going to say, hell yeah, I'm going to take the $1 million. That sounds fantastic. A penny, what are we talking about here? But let me bust out a calculator and show you guys a little something interesting here. Okay, so here we have our calculator. And let's say that what we're going to do is we don't want to start with 10 cents. We want to start with just 1 cent. And we are going to double that every day for 30 days. So on day 1, you get a penny. On day 2, we will double that. You have 2 pennies. On day 3, 4. On day 5, 8. 6, 7, 8, 9, 10. Oh, I missed one. 10. So after 10 days, well done. You have a whopping $5.12. Doesn't seem so good, considering you could have gotten $1 million in the bank. But let's keep going. 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. So after 20 days, here you would have, from the king, $5,242.88. Again, it doesn't seem like a good deal because you could have had $1 million. But let's keep going for those last 10 days. 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. $5,368,709.12. This is the significance of compounding interest. Now, as it relates to a person's health and well-being, what does this have to do with a head and a neck injury? Yes, sometimes we're going to have the symptoms show up right away, but other times they are slowly going to be accumulating and ultimately accelerating over a long period of time. Red blood cells, most of the tissues in your body that make up your muscles, your ligaments, your bones, your joints, all of these kinds of things, they have a turnover of, on the average, around 90 to 120 days. That is 3 to 4 months. So let me make it simple here, and let's say a turnover of 4 months. Well, that would mean that 30 cycles, as we've just illustrated right here, that would correspond with about 10 years. And what I can tell you based on my years of clinical experience when working with people who experience many of the things that this person is actually describing here. So weakness, pain all over their body, dizziness, migraines, headaches, other kinds of neurological disturbances. The average person does not experience symptoms for about 10 to 15 years after they have had some kind of a physical injury. How do I know that? It's because we do diagnostic tests. Part of what we do as our workup are either DAX, so digital articular x-rays, or what's called a CBCT scan, where you can see the health of the bones, the joints, the disc spaces, and also the overall curves and the function of the spine. And the vast majority of people that we see signs of degenerative arthritis. Degenerative arthritis has nothing to do with stress. It has nothing to do with biological age. It has everything to do with the age of an injury that is accumulating compounding interest over a long period of time. And on the average, the amount of damage that we see is consistent with a person who had an injury 10 to 20 years ago, which is why we oftentimes say just because there was no broken bones, bleeding, or maybe not even any bruising, we thought that we were okay. But the effective compounding interest accumulated over a period of time leading to the damage. And when you have increasing amounts of damage going on the inside over a period, it slowly is going to whittle away and decrease the amount of stress that it takes to essentially overload a person's neurology. And then depending on what part of the body, what part of the brain, what part of the neck is being affected, those are the symptoms that are going to manifest. So just because we may have an injury in the past and we thought we were okay, because of compounding interest, it's possible that the issue may show itself many years later. So let's go back to what this person is describing. Here they are 4 years on, and they are describing issues that are very, very consistent with concussion and whiplash. In fact, they said that they had a secondary injury, that they had a relatively innocuous hit to the head, and then suddenly everything was so terribly much worse. This is a condition that's known as priming. When we have an initial injury of some sort, when it causes damage, it lowers the threshold and it activates what are known as microglia, which are the white cells of the brain. They're involved with repair, regeneration, growth, all that sort of stuff. But when they get shifted into a prime state, it means that any relatively innocuous insult, again, even a light hit to the head, a fall on the tailbone, or if we are exposed to certain kind of chemicals, certain kind of pollutants, things in the environment, or sudden episodes of severe stress, this can shift our body into a state of hyperinflammation, and then inside the brain, these microglia go into an activated, or what's known as an M1 pro-inflammatory state. It's the difference between having a low-grade forest fire versus an out-of-control wildfire. And when you've got inflammation affecting the different centers of the brain, that has the potential to affect the expression, the function, the health of every single thing that's going on in the body. So what for this person would I'd say, if they have not already had it done so, they absolutely need an MRI. Ideally, I would also add in there a PET scan, because if they're noticing issues with speech, moments of blackouts, moments of what would be called spatial seizures, and I think that they described it correctly, that there's an issue involving the temporal area of the skull, the temporal lobe, which is involved with speech, memory, hearing, different kinds of things like that. Their symptoms would absolutely be consistent with that. Now, in terms of what should they do about that if that's the case, there's a number of things that come to mind. So one of the first and most important is reducing inflammation in the body. And one of the most important and significant factors that produces inflammation in the person's body is the diet. There is a direct link between the brain and your digestive system. It's what's known as the vagus nerve. The vagus nerve is essentially the life conduit that's communicating all of the messages between the brain, the heart, the lungs, the digestive system. 20% of the messages on that nerve go down. 80% come back up. And there's a common expression, garbage in, garbage out. If a person has either a poor diet, they're eating something that's just really not good for them, that facilitates a pro-inflammatory state in the brain. But second to that, if a person has had a brain injury, and it sounds again, there's a concussion here, we also know that there is an almost instantaneous change with the signals that are going from the brain down to the digestive system. When the messages from the brain down to the digestive system are functioning properly, what they do is they maintain tight linings, kind of like this, between the cells of your digestive system. But if you suddenly have that head injury and you're losing that communication going down, that tight lining can start to become leaky like this. As a result, things can start getting into the bloodstream that don't belong there. That sets a person up for autoimmune conditions and also a variety of brain issues. Post-concussion syndrome, brain fog, memory issues, emotional disruptions, just disruption to the entire function of the brain. And this is obviously going to be a little bit out of my area of expertise. I'm not a nutritionist. I'm not a naturopath. I would direct you that you absolutely need to work on cleaning up the diet as much as humanly possible so that you can repair that lining to stop the leakiness. You've got to stop the leakiness if you want the brain to be able to heal. It's also worth, again, if you have not had the MRI, get that assessed. And this is probably going to involve having it work either with a functional neurologist, with a vestibular physiotherapist, because you can heal, you can retrain the brain so that it can function at a higher, more optimum level. Granted, certain damage may not be able to be undone. However, body and brain never forget how to heal themselves. They just need the opportunity to do so. Now, the third bit, if there's anything that I might be able to do, this is my realm of expertise, it has to do with the health of the neck. As we said, you can't have a concussion with also having a neck injury. And if an issue in the neck so happens to be affecting the function of that vagus nerve or affecting circulation in the brain, which it can absolutely do, then it's worth investigating to see, is it possible that in those injuries, something in the neck got jostled, locked into the wrong position. Now it's not moving properly. And as a result, there's no stretch, there's no exercise that's able to be done. That actually has to be released so that the body can actually heal the way that it's supposed to. And this is the specialty that we do, which is known as craniocervical care. It's a different form of healthcare where there's no drugs, there's no injections, there's no stretching, there's no twisting of the neck, there's nothing like that. And especially when people have these more complex kind of issues here, gentle, specific, precise, and personalized is the name of the game. There is not a one-size-fits-all. And indeed, if I was to say, oh, well, the only thing you need to do is get your neck checked, I'd be lying to you through my teeth. That would be absolutely insane. There are a lot of layers that are involved with this person's particular presentation here. And so what it requires is a multitude of approaches that if you can figure out, well, what actually did happen, and even if we can't go back in time 4 years, what can be done now to actually help the body heal itself? So this again has been a little bit of a deep dive here, but again, I think that this one was worth jumping into because I know that if one person feels that, I need to share a little bit of this history here, what would you recommend? Where would you recommend that I go? That this is going to be true for a lot of people. And truth be it, there's going to be a lot of additional things that would happen during the course of this person's discovery. But again, where would I recommend? MRI of the brain, MRI of the neck. Articular scans of the neck as well, done with either a DAX or a CBCT scan. And I would also recommend blood testing, looking for signs of leaky gut and also other factors that could be promoting inflammation through a person's digestive system. This is probably the best place to start, and then depending on what you discover as you go along, this will hopefully guide you to find out what the best kind of solution is going to be. Because even if it may not be possible to get things back 100% to where they were before the injury, any improvement that can happen over a period of time is absolutely worth it. So thank you guys for watching this video. If you found it interesting, please do click the like and subscribe button. If you've watched this and you can think of a friend, family member, client, colleague, somebody else you think would benefit from watching this video, please share it with them. If you want some more information, you can go to my clinic website, which is clearchirospokane.com. And if you are not in the Eastern Washington, Northern Idaho, Southwest Canada areas, and want to find a practitioner who specializes in this particular area, you can go to a website which is called UCC Near Me, so you can find a practitioner near you. Thanks for watching. This is Dr. Jeffrey Hanna at Clear Chiropractic. Get well, live well, stay well. Till next time, take care. Bye-bye.